Unfortunately, my camera has went on the blink, but at any rate, I want to say good morning and welcome to this online panel discussion this morning for the critical discussions on race and healthcare. And this is being hosted today by the Kansas Faith and Democracy Table. My name is the Reverend Bobby Love. I'm the senior pastor of the historic Second Baptist Church in downtown Olathe, Kansas, and I'm the organizer for the Kansas Faith and Democracy Table. And this table exists to organize clergy of color in Kansas around issues of justice and the common good. And you fit into that description. We hope that you'll join us. Today's conversation builds on one we hosted earlier this year on the need to talk about racial equity in communities of faith. This morning, we'll dig a little bit deeper. We'll continue that conversation, and we will specifically focus in, if you will, in the context of how race connects with the issues of healthcare. As we know, it is being discussed in the Kansas legislature for a long time. And that conversation has been whether to expand the state's Medicaid program. Now, I'll have you know that across the United States, millions of people have gained access to affordable health insurance through the expanded Medicaid programs available through the ACA, which is the Affordable Care Act. And yet here in the state of Kansas, we're expecting a healthcare crisis of over 150,000 of our neighbors fall in what we call a coverage gap. And that coverage gap simply means that either they're earned too much to qualify for the state Medicaid program, or they earn too little to receive federal subsidies that would make private insurance attainable. In fact, watch this now, a single parent with two children, making more than $8,354 per year, and that equates out to about $688 a month, actually makes too much to qualify under the current Kansas state law. Isn't that something? So I'm pleased to have with me this morning faith leaders and health advocates from different parts of the great state of Kansas. And I'm sure that we'll have a good conversation today around why this matters to people of faith and what can we do to improve the communities in which we live in and the places where we worship. So first, I want to take time to invite our panelists to introduce themselves. And as they introduce themselves, I want them to actually take a few moments, 2 minutes or less, as we say, to share why this conversation matters to them. And then we'll discuss some additional questions. So again, to the panelists, thank you for being here. And I just want to share with you also, thank you for what you've provided me in my life of meeting you. So we'll go around and introduce ourselves, your name, where you pastor or the organization you're with, and also tell us why this matters to you. All right, so we will start. Pastor Phillips, would you start?
I will, thanks. My name is Laura Phillips. I serve as the senior pastor of Overland Park Christian Church. We're a disciples congregation in North Johnson County. And this conversation matters to me because so many of my congregants are affected by it. We're, like a lot of congregations, trying to grow our family of faith in a variety of ways. And we have a good handful of younger families that perhaps also have kind of the gig economy type jobs, and so don't necessarily have a job that offers healthcare. And so that's a really big deal for a lot of our families. And pastors as well. I know a lot of congregations within the disciples world, but also across denominations, aren't able to provide healthcare for their pastors. And so that's something that affects all of the faith leaders that are trying to also advocate for their people. So thank you for having me today.
Thank you. We'll pass it next to Pastor George Proctor.
Good morning. Pastor George Proctor. I'm pastor of United Missionary Baptist Church in Fort Scott, Kansas. And I'm also the moderator of 7 churches throughout the area, Chanute and so forth, Chanute, Olathe, and 6 others. What I want to say, this is near and dear to my heart for a couple of reasons. One is, as Reverend Laura said, it impacts our congregants, and it impacts the calling that we have as pastors to provide and take care of the meek and lowly. And that I take very serious. And then also the economies that are impacted for hospitals being closed in their particular areas. And not to mention other expenses to seek that health care miles away. And I have numerous examples of that throughout our district. But just with 2 minutes, that's what I want to make sure that you know, that it is very near and dear to my heart, the lack of Medicaid expansion.
Okay, thank you, Pastor Proctor. Let's go with Lacey.
Yes, hello. Thank you for having me. My name is Lacey Kennett. I am the Director of Communications for the Alliance for a Healthy Kansas. And if you're not totally familiar with the Alliance, we are a 501c3 organization that represents more than 125 businesses, healthcare providers, nonprofits, who all want to help all Kansans achieve their highest level of health, and primarily through the expansion of the state's Medicaid program. So the organization, this is what we do. This is mostly what we focus on 98% of our time. And it's important to us because, we have met dozens and dozens of people in the coverage gap and heard their stories. On a personal level, for me, as someone who has lived in the coverage gap myself, and someone who grew up in a family that had a small business, and by small, I mean real small, about 3 employees. Growing up, I saw the difficult time that it was to get health insurance if you couldn't get it through an employer, and just how expensive it was and all of those things. So I have lived a lot of my life in the coverage gap and seen it firsthand, and that's what keeps me going every day. So thank you for having me.
And thank you for being here. We'll go to Pastor Bragg.
Hi, Pastor Bragg of Abundant Life Church. I'm here in Kansas City, Kansas. I think this issue is important because more than just how it impacts us as individuals, I think it gives us an opportunity to help those who need help, who are simply in need. And I think that's the call to all of us as Christians. But even beyond that, all of us who are people of goodwill, people who want to see others succeed, healthcare is a necessity. I don't think anybody on this call would argue that. It is an absolute necessity. And we live in a nation which has the ability to provide health care for its citizens, those who cannot provide it for themselves or who cannot work in a situation that provides it. And so why not? Why not help when we have the ability and the capability to do that.
Thank you, Pastor Bragg. Pastor Glenn.
Good morning, and thank you for having me. Can you hear me okay?
Yes, we got you. Mhm.
Okay, good. I'm Pastor Gordon Glenn, the pastor of Grant Chapel African Methodist Episcopal Church in Wichita. I happen to live in Overland Park and commute every week. I'm also the president of the A.M.E. Ministerial Alliance of the Greater Kansas City area, as well as the acting president of the Methodist Ministers Fellowship, also in the Greater Kansas City area. I've thought about this question, why this matters to me, and I think about my congregation. And my congregation has a few things going on. One is that it's an older congregation. I have a lot of people that are grandparents and great grandparents in my congregation that are taking care of their grandchildren and great grandchildren. Because their children and grandchildren aren't able to provide all that they need to provide for their own children. And then we have some younger families that also have children. I have several families that have several children within the household, and it just becomes very difficult for just to make ends meet, with jobs and things along those lines. I had a friend once that was telling me that they were, didn't know much or care much about this whole Medicaid and Medicare because, hey, they should get it from their jobs. I'm like, well, you can't always get it from their job. And sometimes there is that gap between what their jobs may provide, able to provide. My church is also uniquely situated geographically. We are right next door to a rescue mission. And we see people coming in and coming through that are dealing with these types of health issues that are unable to get help in a lot of different places because of the wealth disparity, making too little or making just too much, and so they're not able to get the care that they need. So this matters to me, not simply because I have health insurance, good health insurance, but it's not about me. It's about people that don't have it, and those that do need to advocate for those that don't.
Very good. Thank you, Pastor Glenn. And next I'll go to Pastor Rowan.
Yes, says you run First Baptist Church, 5th in Nebraska, Kansas City, Kansas. And I was listening to everyone, and I'm reminded of that song that says, we all stand in the need of prayer. We all stand in the need of healthcare. Without question, regardless of income level, we all need healthcare. It should be a basic human thing we do in this country, that no one should ever have to worry about healthcare. It's important.
Thank you. And I think I've got all my panelists. So again, thank you. And again, I apologize for my camera. It's just like when you're expecting company, you get the house all cleaned up and everything. And then prior to company coming over, you have a catastrophe. So that's what has happened to me this morning. So I do apologize if my camera has a mind of its own today. So as you may know, again, we welcome all of you to this space on this critical discussion about race and health access. We started this table where we had these critical conversations focusing on faith and race. And now we're focusing on Medicaid expansion here in Kansas. So let's start with race and racial equity. Why, in your opinion, is Medicaid expansion not only a health issue, but also a racial equity issue? And I just want to kind of put that out there for conversation. I do want to let those of you who are viewing with us from other platforms this morning, it might do you well to know that people of color are far more likely to be uninsured than white people in the state of Kansas, as well as nationally. So let's kind of open this up and kind of see what our opinions are or comments are on that subject matter. So who wants to go first, or shall I just call on you? I think I want to go with Lacey. Can you give us some vital information on this as we open up our discussion this morning?
Sure, of course. So yeah, we know that in Kansas, people of color are far more likely to be uninsured, as well as nationally, like you said. And what we've seen from, well, let me preface it by saying that Kansas is now one of 11 states that hasn't expanded its Medicaid program. The most recent one was just in the November election. South Dakota voters voted to expand. So Kansas has really been left as an island, as a state that hasn't done this. And I guess I'm not going to say benefit because there's no benefit there, but one of the things that happens when you're one of the last people to do something is you get to see the results from all of the people who have done it before you, right? And so compared to non-expansion states like Kansas, states that have expanded Medicaid, they have lower disparities between communities of color and white communities in as far as medical debt goes. There are better improvements in the early detection and treatment of chronic illnesses and deaths associated with chronic illnesses. And you know, it's a benefit to all communities in Kansas. We know that there, with that increased federal funding that comes with Medicaid expansion, facilities who treat, serve communities of color and treat, say, through Indian Health Services and places like that, these facilities are able to provide more services, so people don't have to drive as far to get these services, especially in rural communities. So that's my super fast overview, if that helps get us started.
Sure. Thank you. Any of the other panelists would like to comment on what she stated? I know Pastor Proctor, Lacey, on what you indicated. I know in his particular area, and the area where Pastor Proctor has churches at as a sitting moderator in the state of Kansas. He covers from Humboldt, Kansas, the Iola area, Osawatomie, Paola, Ottawa, Fort Scott area. And in that particular area, he's experienced where they've had hospitals that have closed. Can you share a little bit, Pastor Proctor?
Yes, I was just getting ready to piggyback on what Lacey said. A lot of the hospitals that were in or close to poor neighborhoods are having to close or limit their potential to provide the necessary services. And as a result, that is discriminatory to those that are in need. Not to mention that Kansas even wanted to charge, if it was approved, $25 per family to do that when they didn't have any. So it's not only critical, but it is absolutely obvious that it has racial connotations that need to be addressed. And I was looking at some of these numbers here. Kansas is letting $1.3 billion just sit on the table that they could get with Medicaid expansion to take care of not just Blacks, but take care of all the economies in these small towns. And it's just ridiculous. But I agree with Lacey. Matter of fact, I read a lot of you all's information that you send out, Lacey. And you may want to let people know how to get that because it's very informative.
Yeah, so we've got all of this information on our website, which is expandcancare.com. And we've got a tab that's called resources, and you can find we have all of the arguments for CanCare expansion, but we do separate it by topic if there's something interesting there. But you can also sign up with your email address and get emails from us. We send out emails a couple times a week and keeps you up to date on what's happening in the world of expansion and new data when it comes out. Just things like that. So we'd love to have you join us.
Well, thank you again. We've got faith leaders who pastor congregations, and I'd be interested in knowing, as we talk about this particular topic, expanding Medicare, and even just healthcare in general, if you will, how, as a pastor, or people of faith, how do we connect this issue with faith, and why should people of faith be actively involved in this fight, do you think? And I'll just open that up. Pastor Glenn, you want to lead us on that?
It's a moral issue. Our Savior, who we're in this season welcoming Advent, where I guess for me it's so clear that sometimes it's hard to put into words why it's such a clear moral issue, because our Lord came to seek and save the lost and those that are in need. He said the physician doesn't need a physician. The well don't need to be made well. And so I think it's all of our responsibility, believers, and if you're not a believer, to take care of those who are struggling. And I think it's a mandate, it's a command, I believe, to look after those that need to be looked after. Not in a sense of just kind of placating and just kind of giving a little this, giving a little that, but really empowering and really putting resources where needed to have resources so that we can level the playing field a bit and help those that need help. I really do see a connection between what our Lord was trying to teach us in his walk with what we're supposed to be doing with our fellow human being, with our fellow creation. I saw something on TV that was saying that we treat human beings worse than we would treat a dog on the side of the road. Wow. We would stop. We would want to help. We wouldn't want to do all this or whatever. But if it's a fellow human being, they're able-bodied. They can make it on their own. I made it. Let them make it on their own. So that to me is troubling. It's problematic, and people of faith need to stand up and say this is not just a social issue. This is a faith issue.
Okay, all right, Pastor Phillips, and then we'll go to Pastor Proctor.
Well, I would certainly echo what Reverend Glenn talked about. I was trying to think about the ways that Jesus' healing sometimes disrupted the status quo and disrupted perhaps even the economy. And so I can't help but wonder when we're fearful of expanding Medicaid or some version of that would change the status quo for a lot of people. I think about the ways that Jesus just healed people and didn't care about the status quo until later, because he knew that the wholeness and the life of the person was far more important than the status quo or the society. And so I think that's one of the ways that I will continue to tie this issue to our faith and how we as faithful people, especially as faithful leaders, are called to speak out, because we saw Jesus who healed people and healed people of all their ills, physical and mental and spiritual, and all of the above. And so that's one of the ways that I will keep connecting this to. We're called to disrupt the status quo just like he did.
Mhm. Very good. Pastor Proctor.
Thank you. I agree with Reverend Laura and also Pastor Glenn. We have a civil rights model.
Mm-hmm.
And in that model, we saw a shift in power. Yes, we need to educate our congregants, let them know as leaders that we are rallying together to support them. Absolutely. And that's why I'm really honored to be a part of this group. But there's a model out there that shifted the power, and that is in teaching everyone what's there. Now we can organize and speak up as a organization and protest, whatever it takes to draw a light on this most obvious situation. But it's not obvious to the Kansans because they continue to vote for people who are against their own interests. And so it's time for us as pastors and leaders to look at that civil rights model and employ that as we move forward and speak up. We're going to give cards and letters and so forth, but we need to also come together and stand out on in Topeka together and really show that this is what we want and this is what needs to happen.
Mm-hmm.
Can I jump in here, please?
Yes, Pastor Bragg. Mm-hmm.
So, I think our conversation is part of a larger something that's happening in our society. I wrote down two thoughts, and I need to write stuff down. So if you see me looking down, it's because I'm prone to forget at this age. But there are two thoughts that I wrote down. One is that and I'm asking just to hear these words. We have monetized health, and then we have monetized health care. So we've put a price tag. We've put a value, a monetary value on people's health. And then we put a monetary value on caring for people. Now, what does that say about us as a society? That what we care more about is the price tag as opposed to the people. I don't know that that's really what we want to say. I don't know if that's what we really think of ourselves, but in reality, that's what we've done. We've said we care more about the bottom line than we care about the people. And I think the second thing that jumps out at me in these kind of discussions is that we use our politics as a weapon against those who disagree with us, mm-hmm. or who we disagree with. And so, I can find all kinds of political reasons not to do this. And I can find all kinds of political reasons not to get behind something that can benefit so many people. But the political reasons are really not the issue. The issue is, I am thinking about the world from my perspective, from my chair, and I don't have to think about it from yours. In fact, what I can tell you is that yours doesn't matter because it's not real. Mine is the only real one in the room, and so that's the only one that really matters. And I think until we address those issues, I think we're always going to have debates like this. I agree that we need to pass Medicare expansion, but I think even if once we do it, I'm perfectly confident that we will. I think once we do, we're going to keep having these debates until we can say to people, until we can get people to say, you know what, my reality is not the only one that matters to me. Your reality matters to you as well. I got married at 25 years old. And, I'm a man. I hope that's not a surprise. But I got married at 25 years old. What did I know about a woman? What did I know about her needs, her cares, her viewpoint? And so my wife and I spent the early part of our marriage arguing about things like me shutting the garage door. Because to me, so what? The garage door is open. You leave it open because the garage needs to air out. And my wife's issue was safety. And I was saying, nobody's going to come in. I'm a man in a man's world. I don't think about those things, but she is not a man in a man's world. She very much thinks about those things. It took me some years to sit in her chair to say, from her perspective, that's a safety issue. Shut the door. What is it costing me to push the button on the garage door so that it goes down? I mean, it's not like I have to go out there and slaughter the giants in order to shut the garage door. Literally, all I had to do was push a button. But I was resistant to do that because her view didn't make sense to me. And that's what I think we're facing, is that if your reality doesn't make sense to me, it's not real. I think that's where we're at in our society. I think that's where we're at in our state. I think that's a moral issue, but I think it's also a theological issue. Mm-hmm. I believe people are made in the image of God. And for me, that matters more than anything else. Mm-hmm. That has to override everything else, whatever else we put on top of that. Whatever, we all have on different clothes, different colors today. Whatever our clothes are, whatever our colors are, whatever the colors we wear today, at the core, we're all made in the image of God, which requires me to then treat you and see you as someone who God found worthy to make in his image. And I think that for me is the bottom line.
Pastor Bragg, as you were saying that, I couldn't help but think about, Luke's gospel, where it talks about an individual who found himself on the Jericho road, and he was overtaken and he was beaten and he was left for dead. And then that shows that he was in need of something. And then what was so striking is that the individuals who came by, who was in a position to help, didn't help. Yeah. The priest came by, didn't help. Because he had his ceremoniously duties to do, ceremonial duties to do. The Levite came by, at least he stopped, looked, but he went on the other side. And what I like about how that story is framed, it says that an individual came and looked and had compassion. And I think we as Kansas, we as faith leaders in all of our churches, if we espouse to say that we care for one another, why is it so difficult that we would share and open up opportunities where everybody would have access? Because see, if we have a healthier Kansas, that helps all of us. Even as a pastor, if I got folk in my congregation that's not as sick because they're able to get healthcare, that's easier on me as a pastor. But what I do like is in Luke's account, the Samaritan, and it highlights a Samaritan. And if we look at that, and I'm not trying to preach a sermon here, I feel my help coming though, that we have an individual who was the least likely to help, did have compassion and put the person in and helped him heal his wounds and so forth. But what I like about it, if I could use it in contemporary terms, he left a credit card and say, if he needs anything else, here's some money to take care of that. And if it goes over and beyond that, I'll come back and take care of it. But what are we saying? We're crossing by on the other side. And I think that's where we are as a state. This need not be a left or a right issue. This needs not to be a Democrat or Republican. This needs to be, we are humans, we are relational, we need to care for one another. As I care for you, I help myself. And that's kind of what we need to look at. And I think this is why I was so excited to get this faith and democracy table set up to help push this, because our elected officials, they're sitting in a position of power, and they're the ones who's looking at this. They can see the same thing, but they're walking on the other side. So I think we can change that narrative. And I want to move now because we're limited on time. Pastor Proctor, go ahead.
Yes. I agree with everything that you're saying, but we also have to be very cognizant of what's going on.
Mhm.
First Timothy says, for the love of money is the root of all evil.
Absolutely. Mhm.
And we see that what's happening out there is if they can't make any money off of this, they're not going to do it.
Mhm.
And we see that with gun rights and all that.
Yeah, everything.
If they're not making money, absolutely, we should use the model that Jesus, everyone should, but not everyone is going to follow that. We need
Right.
to see what we're up against. And there are people that want to privatize this so that they can make money or buy off hospitals that are closed. There was an article out that there's a company that's going around trying to buy the hospitals that are
Mhm.
closing, and all of this. If we overlook that, we're missing what's really happening.
Right.
Can I
So-
come back? I know we're short on time, but can I
Yeah.
come back to the
Yeah, go ahead.
the
Mhm.
parable of the Good Samaritan?
Yeah.
I think what's often overlooked in that passage is what Dr. King said about that story. It is that we can say, in this argument, we can say, those who don't want to do this don't want to do it for whatever reasons,
Right.
and what will it cost us? But I think what Dr. King said about that passage is critical here. That when we look at that story of the Good Samaritan, it's not so much about what will happen to me if I
Mhm.
help. It's what will happen to my brother or my sister if I do not help.
Absolutely.
And I think the issue is, if we look at that parable and we see that the Good Samaritan represents a type of Jesus, it's a Good Samaritan who goes over in the gutter, who goes over in what I call the margins of life.
Right.
The others stay on the road, but the Good Samaritan goes over in the margins of life. And those of us who represent him, who represent Christ, we must go to the margins. We must go to those who are left out, who don't have, in this case, who don't have health care, who can't, just something as basic as who may have never had a checkup. Can you imagine how much a checkup can prevent? And it's not
Right.
about what it will save us in terms of money and, long-term care. What will happen to my brother if I don't do something? And I think theologically, that has to be our basis for acting. It's not about me. You're right. I have healthcare. My wife has healthcare. My children have healthcare. My grandchildren have healthcare. But what about the people who don't? And it can't be about how I'm going to be blessed or harmed by doing it or not doing it. It has to be about them.
Mhm. Very good. Let me pose this to us as we look at this from those different lenses. How does it come out as we put a racial component in that? When we take everything away, why is it that maybe one group thinks that another group is getting over or getting something that they don't deserve? Do you see any of that? I'll just open that up. Who would like to take that on, if you will?
Oh, please allow me.
Absolutely, go right ahead.
I think the issue is we believe in the myth of a meritocracy. We believe in the myth that in this country, people get what they deserve and you work for things and you get things. It's a myth. It's a good idea. It's a wonderful idea, but it's only an idea. And it's a myth in this country because To have a meritocracy would assume that from the very beginning, the playing field is level. And if the playing field is leveled from the very beginning and all of the athletes have the same ability, then great, you can have a meritocracy, because then it becomes about my desire, my will to achieve. But when you start with an uneven playing field, when you start with generations who have been handicapped, and then you put them all at the starting line and say, go. Well, if you already know the path and I don't, or if your people genetically have been able to do this and mine have been somehow weakened, of course it's not going to be a meritocracy. And I think that's at the core of this, is that we don't live in a meritocracy. We live in a meritocracy as far as those who are privileged are concerned, but that's not the whole society.
Yeah. Anyone else? Pastor Glenn?
Just echoing that I've always felt that way. It's if it'd be different if we all were given the same thing, but we weren't. And it's just this continuing to have to explain that to people is very frustrating, frankly. If I can just be, frank about it. Yeah. It's frustrating because there are people that still do believe that whole mentality of being able to achieve in this nation and what they can do to achieve, and look down upon those that don't have similar achievements. And their attitude is, well, what's wrong with you? I did it. I keep hearing these stories about people say, oh, my people came to this country as immigrants and, we made it. And I'm just like, well, yeah, maybe, but a whole bunch didn't, first of all. And second of all, my people didn't come here as immigrants, if you will. We had no choice to come here. So it's just a different story, and I don't want to diminish anyone's story. Anybody that's achieved anything in this nation, great, good on you. But there is a whole lot that if we were given the leg up that some others were given, it would be a different story completely. So the whole notion of being able to suppress some folk as opposed to some other folk is one of the problems we have in this nation.
Very, very good. Pastor Phillips.
Sorry, I was on mute. I can't help but think the one thing that keeps rattling around in my head is the concept of generational wealth. If people are going into debt because they are just trying to go to the doctor, I mean, just even a very basic visit, if you don't have healthcare, is so expensive. And so people are not going to the doctor, and therefore not working, perhaps. Or if they do have a serious medical condition that they have to receive care and therefore then go into medical debt, it just perpetuates this generational wealth problem that already has such a huge disparity. And, I echo my colleagues just that it's frustrating to have to keep explaining things to people that seem really obvious after you take one look at it. But I'm happy to do that as long as if it means that there's going to be some level of transformation. And so when I think about expanding CanCare, that's one of the things that also just keeps rattling around for me, is the idea of generational wealth and what this could do, not only for people that would receive care and wouldn't go into debt, but also generating jobs and income and bringing more economy, improving the economy by just having healthcare received.
Thank you, Pastor Phillips. Lacey, is there any comments that you would like to make in light of what you've heard?
Yeah, I love this. I love hearing what everybody has to say. I will say that what we at the Alliance see so many times is it's really easy for opponents of Medicaid expansion to group people as, the others. But when you get down to the work like we do, where we talk and have relationships individually with people in the coverage gap in Kansas and you know their story, you really see these effects that the tendency of making people the other group, or whatever terminology you want to use, have on them. We did a training in Wichita earlier this year, and we had a group of we call them storytellers. They're people who live in the coverage gap, who want to learn how to tell their story effectively, whether that be to legislators or media or whatnot. So we had all of them get together, working with them, and we had a more experienced storyteller come in and speak with them. And she said the phrase, it was something to the effect of, you are not less of a person and you are not less important just because you don't have health insurance. And just sitting in the room, like the feeling that you got from everybody there, that was like somebody just said the words that I feel every day. I feel when I go to the doctor's office and I have to tell them I don't have insurance, or when I know that there's something wrong but I don't go, and I feel like it's my fault and I feel like less of a person because of this. Just for me, just seeing the reaction in the room made me all the more motivated to keep going.
Well, thank you for sharing that. I want to thank all of you all who took time to tune in, who took time to be a part of this panel. As you know, we got a lot of work to do. We've got new legislators that are coming in that's going to be seated in January. And I just want to share with you that a lot of these persons who are elected in this next cycle, many of them did not even have a candidate to run against them. And this always happens when I'm saying something good, my camera goes in and out. But nevertheless, what I want to kind of move us, because we were kind of on a time crunch here, is I think what our next steps can be as we look at faith and democracy. And this is not about, again, one group over another group. It is what we can collectively do together to move our state in a direction where we actually care for one another. And we are our brothers and our sisters' keeper. So I want to thank each of you for your conversations this morning. And this conversation has moved me and have affirmed me even more that I want to do something to help in this. So before we leave, I want to share what the Kansas Faith and Democracy Table is doing. We're offering opportunities, if you will, for people of faith and in our congregations to take action. So I'm going to have placed on the screen here a postcard that we've put together, and we would like to get these into our congregations. Can you see that? Basically says greetings from Kansas. And this will be something that we would ask as pastors in your various congregations, that you would hand these out to your parishioners and ask them to fill it out. And all it simply says is that we're, because we know that over 80% of Kansans want Medicaid to be expanded. And what we're saying is that we're wanting to know if they're really listening. So we want to send these, have these filled out. I plan on doing it at my congregation. I've got commitments from several other pastors who's going to do the same thing. And I want to let you all know that your congregation can participate in this too. And simply just put their names on it, fill it out. We will collect these once they have been collected, and then we're going to take them to Topeka. Now, in this process, if you would like to have some sent to you, there's a way that we can do that. We do have a form that you can go and fill out and order these, but we will get them to you. And I hope that you'll be able to join us in this this effort to get this information out. We also have a QR code that is available, which we would gladly share with you, that you can use as a link if you are a congregation that is worshiping online. We can get to you the QR code so that your constituents can get the QR code and get this information. So we will physically deliver these in Topeka for our legislators to hear from us. And I'm hoping to have as many of you there at that appointed time as possible. So thank you again. And what I would like to do also is to invite you to be a part of this effort. To my understanding, there is a question on Facebook that has come through. I don't, somebody would have to share that with me. Okay. Do any of the panelists try to reach out to faith-based organizations that provide services? And I think the answer to that, did I get all of it? Organizations that provide services to folks in the coverage gap. Thinking about organizations that provide services to people with intellectual disabilities. So that is a good question. Lacey, is that something in your wheel?
Yeah, I was just trying to look up here. We have so many organizations that are part of our coalition, and I know we have faith-based organizations, and I know we have organizations that work with people with intellectual disabilities. I was trying to see if there's one that did both overlap, but we work with tons of organizations. So if there's something specific somebody's looking for, you can email me, Lacey, Lacey at expandcancare.com. I'm happy to chat with you more.
Okay, put that in the chat box, please.
I will.
Okay. Okay, so that'll be coming to us in the chat box. Okay. All right. Well, brothers and sisters, and to all of you who have watched us, we're very grateful for the opportunity to come to you in this format. I want to share with our panelists, thank each and every one of you who was with us here today. And I do apologize. I got to get a new camera. So, but at any rate, I hope my picture is sufficient. But again, thank you so very, very much for being with us on today. So look to hear from us. This is More Squared's, the Kansas Faith and Democracy Table. So we are very grateful for you. So with that in mind, we will close out and hope to see you soon and hear from you soon. Thank you very much, everybody. God bless.